Hello and welcome to another segment of Appetizers for Success. My name is John Arnold and I'm an executive coach. I'm joined today by my wonderful partner, Marilena Beusis. Marilena?
Hello, John, and also would like to welcome Elizabeth Saenz. Elizabeth and I have actually known each other for a long time, and I have been, a follower of her, but not on Instagram or any of those issues, but more about her career because she really inspires me with her career. It's a pleasure to have her as our guest today. Sorry, our guest. We are the host. And so today, Elizabeth, why don't you tell us a little bit about, where you located and where are you from? Let's start with that.
Thank you, Marilena, and thank you, John, for this interview. I'm very pleased to be participating. Well, at the moment, I am located in Switzerland, Geneva, after a round that took me from my studying years from the UK, then to Vienna in Austria, and now in Geneva. And I am from Venezuela, of course, a country that I love and I would hope to come back one day. And like Marilena, you have said, we have known each other for many years now.
Excellent. So how, tell us a little bit about, for our audiences, how did you make that transition from being in the medical field, because Elizabeth is a physician, and then she went on to do an international career in an international institution. So how did that all happen, and what was behind it? What was your motivation behind it?
Yeah, thank you. That's a nice question, Marilena. I mean, in reality, I went to medical school. My main motivation to become a doctor was always to heal people. I had this desire of doing something, for the people. Then I became a pediatrician also in Venezuela at the Children's Hospital in Caracas. And very soon, for family reasons, I had to travel to the UK. And in the UK, I was a patient of the National Health System. And that really inspired me a lot to understand better how a health system works. Because we know in Venezuela, we do have a health system, but things work differently. Yeah? So this inspired me to pursue studies in public health. So I moved from being a pediatrician, a very specialized clinical specialty in medicine, sorry for the redundancy, to look at health from a wider perspective, from the population perspective. And my master's was specifically on public health in developing countries. So it was like a natural transition to having an eye-opener experience of studying this master's to then connecting to the international work, and then nowadays having the opportunity to work at the global level, actually, looking at health problems from the perspective of populations. And now that we're going through times of pandemic, it's like, for me, it's great that my knowledge and my experience allows me to see the current situation with this understanding.
Elizabeth, we're curious about what were some of the hurdles that you had to overcome on your leadership journey?
Well, I think that the first hurdles were my own, understanding myself as a leader. What is my leadership style? Am I really a leader? Because there is a lot of controversy and a lot of literature that, define what is a manager, what is a leader, whether a leader is born or, all these things that I'm sure you know better than me. So I think that the first hurdle was for me to understand, yes, you're a leader. Yes, you can lead people. Yes, people like the way you lead them. People respond to your style, to the way you communicate with them, etc. And probably the second I would like to mention is when your talents are not identified by your leaders or your managers, it's very difficult to show what you can offer. So sometimes you can be with managers that are more concerned about, results and volume of work, and probably, when you have your own visions, when you have your own style of doing things, it can be difficult to balance that. So probably those personally, I would say those are the two main hurdles.
Yeah, and as a woman, if you were to say, well, did gender get in the way of in your leadership journey? Were there any specific examples that you would like to give us as you were trying to become, a leader, especially in an international setting?
Well, I would say that, in fact, there is an issue about being a woman. The fact that you bear children, you raise children, and you have all these commitments with your family. I wouldn't say that they stopped me from doing anything and from achieving what I have achieved. And probably I have been lucky to work in organizations that do respect and do take a lot of care about this balance, and not only gender balance, but also family life and work balance, which is very important. So I would say that in a way I have been lucky, but I don't think that being a woman has been for me and should be for any woman a reason not to achieve their goals and desires in terms of professional work.
Elizabeth, obviously you're an inspiration to so many people. And so we're curious, who or what inspires you that you can share with our audience?
Yeah. Well, I could go through a long list, but I think since we are talking about women, I would like to mention Maya Angelou for sure. And related to leadership, one thing that I'm very conscientious is she says, people will not remember for what you told them, but for how you made them feel. And as a leader, I think that is something I take very good care about. I try to sense the feelings of people, to understand the life of the person that is working with me, and how that personal characteristics, background, etc., are contributing to the work. Because on the other hand, I always try to see this in a positive way. How can all the background of this person, and I'm talking cultural, religious, gender, etc., can be of use in the sense of how this person approaches work, and the motivation. There is another one that I like very much, and I heard it from Wayne Dyer, is from James Allen, and it says, circumstances don't make a man, they reveal him. Because I do believe that. I think that and I can tell you from my personal life, I never thought I was able to do some of the things that I have done and I'm doing until I'm doing them, until the circumstances have given me the opportunity to prove to myself that I can do them. And probably there are many more. I follow a couple of spiritual people like Deepak Chopra and Wayne Dyer. Oprah Winfrey is a great inspiration for me, and she has a beautiful quote that it's something like, "The light is in the wound," meaning that in my reading of that quote is, I think it's not hers, by the way, but it's like the things that are more difficult are the ones that are teaching you, really. Yeah. So I think that at work and as women, when we identify those difficulties, those hurdles, and like I said, the ones that we put ourselves, then it might be easier to overcome and to succeed in what we want in our careers.
Mm-hmm. Thank you for sharing that, Marilena.
Yeah, I love that. For all of them, but especially the last one, the light is in the wound, because sometimes we fail to recognize, how much learning are we having in the middle of our personal or professional crisis. So with that, and you also mentioned public health, so we're interested. What is one of your takeaways in the work that you're doing in public policy around the world? What are one of those the current situation of pandemic and crisis of health and many other crises originated by a health issue? What are some of those wounds that you think is bringing light?
Yeah, well, Marilena, for me, that's an incredible question, because one of the things I realized in that experience that I mentioned in the NHS in England was that when it comes to health, we are all equal. It doesn't matter how much money we have, what race, what religion we practice. When it comes to being ill, we are ill, and the needs are the same. Yeah. So I think that from the public health perspective, and that for me is a great motivator, that everybody should have access to health services, to quality health services, to that are responsive to their specific needs. So I think that whenever a health system can be that equalizer, and you see this in the more developed countries or the more high income countries, how public transportation, health services, education are like the equalizers, because those needs are common for everybody. And in my field, public health, that is, and you see now, I want to mention again the times that I think that we need to mention the times that we're living at the moment with this COVID pandemic, that no one is excluded from getting the virus. It's just a minuscule particle and can, bring the whole humanity to a halt. So public health for me, and there is a famous phrase, since we're talking about quotes, is from President Allende in Chile. He said, public health is politics at the highest level. Because in reality, what politicians are looking for is the well-being of the population, of the people. And that's what public health is about. When we understand health in the concept of the World Health Organization, that says that health is not the lack of disease. Health is the condition of well-being, and in every sense, physical, mental, and all these dimensions that are related to being happy, to being well, to living a fruitful, prosperous, and productive life.
Before Mary Elena brings us to a close, I have to say the statement you just made, when it comes to health, we are all equal.
Yes,
You
that's it.
you need to put that out to the universe, because I just got these chills when you said that. When it comes to health, we are all equal. That is so powerful.
It is very powerful.
Yeah, thank you. I mean, I believe in that. For example, one of the things that inspires me, apart from the nature and flowers and seeing, one of the things that for me is inspiring is when I see mothers with disabled children, for example. And I always in my heart kind of send these wishes of, and all my love to those families, because it is a huge burden, yeah? And luckily in the societies where the health and social system works, these people have some help, but in our countries, it's really difficult. So who chooses to have a child with a disability? No one, it comes, yeah? So for me, that thing of being, health makes us equal is because disease can happen to anyone at any point in life, from the minute you are born. And I mean, as a pediatrician, a family is waiting for a healthy baby and everything is okay. At the moment of the birth, there is a complication and boom, here it is. The whole life of a family is changed forever. So I believe in systems that care for these situations, because I don't think it's fair to become bankrupt, or, a whole large family not having a life that everybody deserves because of an unfortunate event that ended in a health condition difficult to handle and expensive to handle.
Yeah. Well, in the short time that we've been together today, I have to say you have absolutely inspired me. You really have. And I'll turn it over to Mary Elena. I'll turn it over to Mary Elena for some closing remarks.
Yeah.
Thank you, John.
Yeah, and thank you, Elizabeth, again for your time. You always, have this charismatic and subtle way, in this charismatic way, carrying yourself and carrying your work. So we are extremely blessed to have you today for a few minutes, and hopefully our audience will capture some of those gems that you have shared with us about you, about your work, and about who we are as human beings, which is vulnerable and being with one another. So thank you very much.
No, thanks to both of you for this opportunity, and I wish you all the best as well.
Thank you, Elizabeth.
Bye-bye.